All right. Okay, let us just start. Yeah. Okay. Assalamualaikum warahmatullahi wabarakatuh. And selamat sejahtera, everyone. I am so happy to see 28 of you today. Thank you for joining us for this session. Maybe before we start discussing and all that, kita buat macam sesi ice breaking a little bit lah. As I said, I feel so happy to see the audience here. So this is the session under Child Bilingualism Center. Okay, lupa nak beritahu nama. My name is Rabiatul Adawiyah Muhammad Saleh. So saya pensyarah daripada Jabatan Bahasa Inggeris dan Kesusasteraan under Kuliah of Islamic Revealed Knowledge and Human Sciences. Kuliah tu maksudnya term UIA maksudnya faculty. So IKHS ni the biggest faculty dalam UIA lah. So ada 11 department, my department bawah IKHS. Okay, so the session yang you guys attending is under Child Bilingualism Center. Apa benda tu? Okay, itu pusat kajian untuk perkembangan bahasa kanak-kanak. Jadi selama ni kami dah banyak buat webinar program-program berkaitan dengan perkembangan bahasa kanak-kanak. Dan tapi because of the pandemic and all that, so kami cuba macam be more what they call branch out a little bit. So macam last week kami buat on children digitalization pornography. So this week kita buat on public health and reopening of school. So the team is there. The team of children is always there. Alright, jadi nanti saya akan suruh student saya letak semua information tentang our center at the chat box, so you guys can kalau nak follow our updates, you can just follow from there. Alright, so for today I have the pleasure to invite our guest speaker, one of my friend. One of my good friends, Dr. Muhammad Farhan Rosli. So thank you so much, Dr. Farhan, for joining us today. Kena paksa.
Hi. Thanks, Ruby. Dia macam apa? You cannot say no kan. So, orang kata apa? Paksa rela lah.
Kalau tak habis putus sahabat terus kan. Jadi macam terpaksa juga macam okay. But by the way, nevertheless, thank you so much. So Dr. Farhan is also IUM lecturer under Kuliah of Medicine. He's a public health specialist, and currently he's also the director for director for Selangor COVID-19 Task Force Operations, right? I hope.
Yeah, you're right. Correct.
All right. And also, Dr. Farhan, last week we have the PPV in IUM. So Dr. Farhan was also one of the backbone for that. So thank you so much, Dr. Farhan, for for vaccinating IUM staff, students, and all that. Dr. Farhan, can you please introduce yourself a little bit?
Sure. Assalamualaikum warahmatullahi wabarakatuh. I'm very happy to be here. I think we're going to be having quite we call a semi-formal discussion. So I joined IIUM back in 2015, if I'm not mistaken, 14. And I finished my post-studies in UPM. In public health. I'm in the community medicine department based here in Kuantan. But since the pandemic started, since it's our bread and butter, I guess, I've been shipped out to certain areas such as in Sabah, then back to Selangor, and I've been semi-seconded to the state government, and I'm also helping out with the Penang state government as well. So just bits and that I do what I can for when they ask for help. That's about it.
All right, thank you so much, Dr. Farhan. Okay, so before we start the discussion, just I know I mentioned I can mention a casual session. Okay, I will ask questions. Saya akan tanya soalan pada Dr. Farhan. Lepas tu the audience, Dr. Farhan, it's yours. You can ask questions, but it must be public health related. Okay, so soalan macam Dr. Farhan dah kahwin ke, berapa ramai anak Dr. Farhan, itu semua soalan bawang. And I actually do have a bawang session. Okay, very popular session that I organize. That one you can join my bawang session, and kita boleh discuss those kind of questions. For this session, kita ask public health related matters. Okay, yeah? All right, so Dr. Farhan, I think sebelum kita bincang tentang pembukaan sekolah kan, sebab I non-medic, so I have my knowledge, I have to tell you the truth, is sama je macam knowledge dalam TV. Apa yang media beritahu I, apa yang dalam social media, itulah my knowledge. Right? Kalau I rajin sikit, baru I macam baca-baca sikit. So, sebelum nak tahu pasal pembukaan semua, boleh tak you beritahu pasal variant Delta ni? Because this is the dominant one. And then, how is it different from the other variants in terms of jangkitan?
Okay, that's a good question. Okay, sebelum kita nak cerita tentang variant, let's just have a brief short course on the virus itself. So COVID-19, as you know, is a coronavirus. Actually, coronavirus ni is extremely common. It's one of the most common viruses. It's just that this usually it's found in bats, in cats, even in some mammals. But what is important to note is that this is the one that is what we say growing in the humans and passing to one another. So if you look at SARS last time, so it was a brief scare, but we managed to die it down. And then we had MERS-CoV. So MERS-CoV, CoV is also a coronavirus. So we had another scare, higher death rates. But then with COVID-19, what we saw was that the transmission daripada one person to another person, it was much higher and much faster. Actually, it was not that the transmission was faster. I think it was more of we were unable to detect it much earlier. So yes, we talk about reports about it being from one marketplace in China and all these things, but these are all unsubstantiated. So we don't have enough evidence to say where it started from. But we know that it's being passed on much faster than anything that we've seen. However, the death rates are actually quite low. Maknanya kadar kematian, actually, if you ask public health people, it's actually quite acceptable because it's actually pretty low. But the reason why it's very sensitive is because that a lot of people are dying very fast, and a lot of people at the same time, and people that we know. So that's why it's become a sensitive matter. So if you look at the virus itself, the virus pula, dia ada banyak different variants. So what do you mean by variants? Variants are kita panggil macam transformers lah. Okay, so you have this, and then it mutates itself to a different variant, and then to a different variant. So it changes its what we say its shape, or rather its identity. So it avoids detection. So what do we mean by avoiding detection? Avoiding detection of our immune system. So when you talk about variants, Delta plus, it's not that they found something with Delta. It's just that that is the number of strain that it's found. And then they macam shift sikit, so kita panggil Delta plus. And then in Peru, we find something else, so we call it Lambda. So actually you're following the Greek alphabet. So that's what the variants are. To be too scientific about it, I don't think it's going to be on anybody's interest. Cuma what we know is that kenapa variants, you ada variants of interest and variants of concern. So variants of interest, it's new and upcoming variants such as Lambda. So dia tak ada dalam negara kita lagi. So kita panggil it's an interesting variant, we must pay attention to it. So when we talk about Delta, we say it's a variant of concern. Kenapa? Because we are seeing people who get vaccinated are still getting infected. But the reminder is that even though that's the case, even if they get infected, they don't get severe COVID or severe forms of COVID. So this is what's important. So that's why it becomes a variant of concern. But right now, Delta has taken over everything. So it is now the variant of, it's the main variant, which means that this is the variant that is the majority amongst the public. So that's about the variant itself. And why we pay attention to it is because vaccines that we develop are based on what was the virus early on. So kita jumpa orang ni, dia pakai baju warna biru. So kita dah buat kita punya defenses to attack orang baju warna biru ni. Dia pakai short sleeve, dia pakai ni. Tiba-tiba by the time dia sampai, dia mungkin pakai baju biru stripe putih. So that's like Delta plus. Okay. So alamak, padahal kita punya roadblock, which is our immune system, which is the roadblock yang kita dah set up ni, kita dah letak polis to jaga so that we don't allow it to attack us. Tapi polis ni has been given this script, look out for a guy wearing a blue shirt. So bila dia jumpa, alamak, blue shirt with stripe, you know what? Some of the police are going to let them go. Some of the police are going to take the high road and stop them and not let them come in. Dia macam tu. Tapi bila kita ada variant of interest ataupun some variants yang completely change themselves, dia pakai baju warna merah like me. So the police who has been given this vaccine script to stop, alamak, pakai baju merah tak bahaya kot bagi masuk. But actually it's the same person, he's just wearing a different shirt. So that's why these variants are something that kita kena pay attention to, because we want to make sure that whatever police kita letak untuk block this virus daripada masuk, kita dah make sure that no matter what color, they still recognize the person. So that's the idea of making sure that we make of the updation of the virus. So kalau kita cakap pasal booster nanti semua kan, so nanti basically kita bagi script lah dekat polis yang jaga badan kita ni. Look, right now dia boleh pakai baju biru, merah, kuning, hijau, purple. Now you look for the face. So kalau nampak muka ni, tak kisah pakai baju apa, you jangan bagi masuk. So that's the what we call the booster and all these things. So that's the idea of immunization, that's the idea of vaccines, and that's the different type of variants sebenarnya yang kita nak try stop lah. So different masking kita panggil. Hope it was clear enough lah.
Okay, clear. It's just that because talking about the Delta itself tu kan, yang interestingly a few days ago, the Health DG mentioned something about membiak dalam hidung. So can you something about that? So like,
okay, so banyak orang, I was also asked that question actually, not even in this session, it was actually from a previous one. I think what the DG was trying to say was trying to break it down so that the lay people understand that the virus can grow. It's not like saying as in membiak, it's just that the way the media interprets and puts it in writing makes it sound awkward. Dia macam tumbuh macam cendawan kat dalam hidung ke apa ke, because people don't try to grasp the idea. But what I think the DG is trying to say is that it may stay in that area, because once it's passed from one to another, it may linger in your nostrils. So the viruses are extremely tiny. So perhaps bila kita buat swab, sebab kita lalu hidung semua, that person may be positive, tapi bila kita check dia punya body, they may not be infected with the virus, but they can actually carry the virus at this pathways of respiration. So I think that's the idea yang nak tu. But what's important from what the message that the DG is trying to present is this, is that if it can actually linger around in your respiratory punya tract, pernafasan kita ni, so if we were to meet people who are unvaccinated, we may be able to pass this virus to them, and that is what's concerning. Itu yang kita risaukan.
Okay, all right. So sebab now we are slowly going to that school part. Boleh tak lagi more about Delta ni, and how does it affect children? Because I baru tengok CNN, and apparently in US, dorang buka sekolah recently, and then tiba-tiba ramai kanak-kanak yang masuk hospital, and some of them are severely ill because of that Delta. So that variant. So can you elaborate more on that?
Okay. What do we talk about Delta? All the other strains can infect children. Actually, even from the very beginning, children have been infected. It's just that now why you are seeing a higher rate of children getting infected in the United States is because the children are unvaccinated. Okay, so if this variant was to emerge, say 9 months ago, all the adults would be having Delta. But because there is a high number of population in the United States of adults who have received vaccination, that's why the reported cases of kids having Delta variant are actually on the increase. At the same time, because of the relaxation of the environment in the United States, in the UK and stuff like that, diorang dah longgarkan SOP diorang kan, tak payah pakai mask, tak payah pakai itu, only in certain areas they need to do so. It's not mandated. So these people, because of the boleh membiak, ya, sebagai kata DG, so when they go back home, they can pass this back to the children who are yet to be vaccinated. So that's the natural cause. So we do expect a lot more children to be infected with the Delta variant. And it's obvious because the parents are now lingering more, they are mixing more, so they have a higher risk of passing the virus to the children.
So are you saying that children also, because before this, dorang kata children are not low risk. So
children, I wouldn't say low risk. It's just that they have a low risk of manifesting any type of symptom. So do not make the mistake thinking that children tak boleh kena COVID. Children can kena COVID. It's just that their immune systems are much more stronger than us to actually not show any symptoms at all. So if you don't test the kid at home may have COVID, but you just don't know, and they don't have any symptoms, and their immune system has already fought off the virus. Because kids' immune systems are very robust. They are extremely strong. And that's what's unique about kids. So that's why kalau you jangkit daripada budak, you akan demam teruk. Kalau budak jangkit pada you, budak tu chill je. So it's more of like their immune system is strong. It's not that they are immune from COVID. It's very different, yeah.
Okay, that is very clear. But sebab when we talk about children, yang vaccination tu hanya kata for 12 hingga 17 tahun kan? 12 hingga 17.
Hopefully.
Okay, all right, yes, okay. Tapi let's say children with underlying diseases yang below the age of 12 though. So do you think, we're going to school now, do you think they should go to school?
Okay, I think there's two categories in school. I think it's easy because we can split. We have sekolah menengah and sekolah rendah, right? So 12 to 17, and we have 11 years and below, before they're 12 years old and below. So darjah 1 sampai darjah 6, even Tadika and Taska. So from the data that's come in, kita nampak where that kids umur 12 hingga 17, they can actually get vaccinated. For me, prior to you rushing to open schools, sebab I rasa they wanted to open it in end of August and then September, now it's pushed to October. Technically, you buka October, November nak cuti sekolah dah kan, end of the year. So why need to rush opening school, sedangkan you actually need to think of how you want to open safely. So how do you want to open safely? Number one, what is the main priority? So the government has abolished all types of examination, betul tak? UPSR dah tak ada, if not mistaken lah. Then PMR dah tak ada, right? There's no more centralized exam, correct? Tak ada dah kan?
Tinggal SPM je lah.
Tinggal SPM. So your main priority groups is the SPM. So you want to get these kids inside schools. So if the data shows that you boleh vaccinate 12 to 17 years old, you can vaccinate all 12 and 17-year-old kids. Those who are vaccinated, they are allowed to go to school because the teachers are vaccinated. Now the kids are vaccinated, so they are safe. Now for the children who are 12 years old and below, how are they supposed to go back to school? So you have to practice the concept of herd immunity. You got to make sure that all the school children who goes there can get themselves tested, their parents are vaccinated, all their teachers are also vaccinated. And that's why this thing becomes a national issue, because it doesn't just solve one problem. You cannot have the Ministry of Education saying kids can go back to school, but there is no holistic approach to you trying to solve the issue. That's where now you have to have the national testing policy coming in. So you need to have a strategy. Kids who go to school, how often do you want to test them? Who should bear the cost of the test? When should they do the test? Is it on Monday? Is it on Friday? Kalau Monday, waktu pukul berapa? How is the teachers going to conduct it? Who is responsible for it? If they are positive, what is their pathway? If they are negative, do we test them next week? So all these things need to be ironed out even before you can even think of buka lah sekolah, sebab parents demand the kids to open. Because why? You have to remember why parents demand. Parents demand sekolah kena buka sebab diorang punya office dah nak buka.
Yeah, true.
All right. That's the majority of parents. I know that there is some groups who wish for their kids to have education in schools, because nothing can replace face-to-face teaching. Online learning ni tak ke mana, because we also know we teach our students pun diorang semua ke laut je, kan? So nothing can replace face-to-face teaching. But face-to-face teaching needs to be done in a safe manner. So in the safe manner ni, prior to us engaging this safe manner, that strategy needs to be put in place. So kalau strategi ni kita tak ada, we have not formed it yet, we should not even be announcing dates of reopening, because it's so dangerous when we do that. And trust me, you don't need a lot of kids to get infected. Even if you have like maybe 5 to 10 kids yang meninggal dunia sebab COVID, sebab dia pergi sekolah, believe me, it's going to be a complete blowout.
True.
And the whole country is going to be so angry.
Betul, dia akan jadi uproar.
Correct.
Yes.
Everybody's going to be so pissed off because we have not taken the necessary steps to open safely.
Yeah.
Yet at the same time, now we have a buffer, kan, until December. So tak payahlah kita nak rush bulan 10 nak buka sekolah ni ke apa ke. Rather, why not kita bagi tahu dekat parents, look, we are thinking of how to open the school safely. We are targeting to open schools on the 2nd of January. This is our laid out strategy. For SPM macam ni, untuk budak sekolah macam ni, untuk budak sekolah to come to school, this is the parameters, this is the things that needs to be done. So now you kena fikir banyak benda tau. You are the special children, you are the kids with special needs, you are the kids with cancer, you have kids with lymphoma, you have so many parameters that you have to think about. So it's not just about making a popular statement on when you want to open school, but it should be a holistic approach. Macam mana you nak buka institutions of learning safely, regardless of whether it's popular or not popular.
All right. Okay, that is very, very, very enlightening. So kita nak come back to Malaysian punya deadline of opening school, which sebab you mentioned about national testing strategy, so I have a question about that juga. Sekarang ni kalau ikut Kementerian Pendidikan last Dr. Razi, kita tak ada Menteri Pendidikan lagi kan, tapi last time Dr. Razi mention.
So sekarang kita boleh kutuk-kutuk lah.
Boleh.
Kena lantik, okay?
Okay, so Kementerian dia kata sekolah akan dibuka by 3rd October ikut fasa 1, fasa 2, fasa 3. So fasa tu ikut negeri itulah. Tapi kan Dr. Farhan, I was thinking bila I tengok list of countries, list of states tu, I am worried. Sebab contohnya dia kata fasa 1 tak payah buka dulu. Fasa 2 untuk budak-budak SPM, so 17 years. Okay, fasa 2 tu merangkap negeri-negeri Kelantan, Terengganu, Pahang, Perak, Penang kan, and Sabah. Fasa 3 Perlis, Sarawak, Labuan. So kan fasa-fasa ni, diorang ikut number of cases. Masalahnya testing is not done much in fasa 2, fasa 3. So how can they be so sure about opening fasa 2 dengan fasa 3 ni? So what is your opinion on that, about all this fasa-fasa?
So Ruby can take over my job because you've been asking them the same question. And to be honest with you, this is the problem when you have policy making that is not based on data and science. Let me answer your question by giving you the scenario or asking you this question. Apa beza fasa 1 dengan fasa 2? Do you know?
Tak tahu. I don't know. Orang kata ikut numbers. I don't know. Audience tahu ke?
Tak sekarang. Fasa 1 fasa 2 boleh makan dekat restoran.
Boleh kan? Fasa 2 boleh.
Fasa 1
macam banyak. Fasa 1 bukan boleh juga ke?
Alright. Fasa 3?
Lagi boleh.
Alright. So fasa 2 boleh main sports, boleh main basikal semua.
Boleh.
Fasa 1?
Pun boleh kan?
Okay.
Boleh.
So KLCC Pavilion fasa 1 buka tak?
Buka. Kan?
So now you tell me what is the difference between fasa 1, 2 dan 3?
So there's no difference. Kan?
The problem is because we move to make decisions based on populist thinking, based on populist demand, yet you want to base your national recovery plan on phases. Sedangkan tak ada perubahan daripada fasa 1 ke 2 ke 3. Sekarang tak ada 10 km restriction. Tak ada tu semua kan. Now you imagine, for me, it's safer to be in Selangor rather than to be in Perlis or Kedah.
In Perak tu lah.
Okay, Selangor fasa 1, Selangor is in phase 1, right? Because we have high number of cases.
Yeah.
Kedah phase 2, betul tak?
Betul.
I mean, Kedah not phase 2. I mean Perlis
phase 2.
Perak phase 2.
Okay.
Right? I am more concerned being in negeri yang phase 2. Kenapa? Because the highest rate of vaccination is actually in Selangor and KL.
Yes.
Those states do not have the higher rate of vaccination compared to us. Yet they have more freedom. And you know that with more freedom, you have a higher risk of contracting the virus. So which is safer? Actually, dua-dua lah tak selamat. Tapi it's much more safer for me to feel in Selangor compared to states that have opened in that way.
Yeah.
Because now, it is counterintuitive. Because even when the drafting of the phases for the NRP was done, it was completely absurd because the parameters that's being used is not parameters that's guided by data and science. All right, number one, absolute number. Macam mana you nak guna absolute number kalau Selangor has the highest population in the country? Macam mana you nak guna absolute number when you compare dengan Labuan? Labuan only has 100,000 people. Labuan is such a small pulau, you can control it in so much easier, yet diorang punya rate of infection, which is their transmission rate or not, is higher daripada it Selangor at one point. So we have to look at it in those sense, right? Even though Labuan ada 200 cases, ada berapa 200 cases, I tak ingat lah 200 cases or something. Selangor had like 6,000 ke apa ke, but the positivity rate actually was much higher in Labuan. The R0 was actually higher in Labuan compared to Selangor. If you look at the R0 chart, actually Perlis had highest. I think last week it was at 1.4, 1.44, and then Selangor was at 1.01. So you cannot compare Selangor to Labuan, right? Labuan punya cara is different. So when you want to open schools, it's not about opening based on phase ke apa ke semua. It has to be extremely tailor-made to region, to population, to district, to state. You have to go to the granular. So bila you buat a policy yang boleh ambil pukal that you think that you can apply it to everywhere, it's completely wrong. Kenapa? Kalau you masuk ke dalam Sarawak, you akan tengok diorang duduk rumah panjang, ada lebih 20 family dekat dalam satu tu. Diorang pergi dekat orang punya community place untuk diorang punya schooling ke semua ke, those places you can open up the schools because there is no way that you can distance themselves from each other pun. Actually sekolah-sekolah kat sana semua dah boleh buka pun because they go on the same boat. Even if you go to Pahang, kalau you masuk dekat dalam tempat Kuala Tahan, all the orang asli live in one community, they all go on the same boat to the same school dekat kapal bantal tu. So there's no point in you trying to prevent them from actually opening the schools. These people can operate because diorang memang tak akan ada social distancing no matter what you put in place. And you tak boleh ada enforcement in this area. Trust me, you tak akan buat. All right. And the reason why I'm able to do this because I have spent years in Labuan. I spent time dekat dalam rumah-rumah panjang kat Sarawak. I spent time dekat dalam Kuala Tahan ni. We've seen these places. So these places should go on. They can live normal lives. Yang masalah dia sekarang is in the urban places, is in the cities, is in Selangor, KL, our metropolitan areas. How do you want to operate safely? Because dekat sini, kalau you blow up your cases, you get it to be completely uncontrolled. You overwhelm the healthcare system and all those things. So back to that statement, kan, Ruby. Policy, as much as we have this big distaste for politicians, but the policy dictated by politicians is the guiding principle that is going to be used by the implementers and also by the civil servants. So if the policy is flawed, how do you expect implementation to actually be carried out in a proper manner? Definitely, you will not be able to match, and you will have a failed system. So that's why the system of governance, especially in a pandemic response, needs to be absolutely bulletproof for you to be able to come out of the pandemic safely. And it's as simple as a ministry talking to another ministry, right? You tengok lah kan, 3 days ago, DG kata, I am very, very sad that the GPs got their contracts to give vaccinations not to be continued. The CITF did not continue it. But PH Corp, which is the governing body, is owned by the Ministry of Health. So now you start questioning yourselves, kan? Siapa yang own siapa? Who is in charge? Who is giving orders? So these things, when you don't have this good risk communication, you don't have what we call uniformity in governance, then you will never have a uniformity in response at the ground level. So you akan ada a failure in the pandemic response, which is what we have been going through for the past 1.5 years.
All right. Okay. All right, Dr. Farhan. So you're the public health specialist. Kan sekarang kita, okay, just be honest. When do you think we can open school safely?
We can, okay. See, my response will be, we can open school safely when we have put in place a policy and a strategy on how we can how we can open schools safely. Now, if you ask me, give me a timeline, I will tell you the timeline starts when you actually have the policy in place. So if I tell you, we want to open in 1st of November, but 1st of November strategy tak ada lagi, you cannot open. If I am being very honest with you, buka 2 January, tapi from here until then, they only fight in parliament and they don't think of the national strategy, you should not open in January because you put kids in danger.
Yes, yes.
Because kan, you kena faham tau, what do I mean by strategy? Strategy ni not just about giving this sci-fi cantik punya plan and say macam, oh, kalau ini. No, it has to be extremely granular so that every single person in all levels understand their role. For example, guru besar, kalau dia jumpa ada kes positif, he doesn't panic because the guidelines is there. Kepada guru besar, kalau ada kes positif dekat gate depan, apakah anda perlu laksanakan? Oh, anda perlu ada satu kawasan untuk meletakkan kanak-kanak tersebut. Done. Okay, guru kelas. Anda dah tahu jika kanak-kanak tersebut pernah menghadiri kelas 24 jam lepas ke apa ke ataupun 3 hari lepas, anda kena kuarantinkan kelas itu sahaja. Okay, done. And then you conduct the saliva test kit. At the same time, you kena bagi tahu dia orang macam mana nak melaksanakan cara memberikan pemakanan. Ataupun macam mana. Kalau dia dah semua negatif, dah masuk sekolah tu, dia orang sekarang in a bubble. When they are in a bubble, you don't have to start make the teachers give the food to each of them on the table. They can actually start mixing around already because they're already negative, because they have done the testing. Okay, their parents already vaccinated, so it's extremely low risk. You have to make sure the ventilation in schools. What is the criteria for ventilation? Maknanya pintu kena buka, tingkap kena buka, kipas kena ada. And then you kena make sure that mereka kanak-kanak yang duduk dengan keluarga yang berisiko tinggi, bermakna mungkin mereka anak daripada healthcare workers, mereka anak daripada staff nurses ke apa ke. So they have to get themselves tested. Kalau ada symptom, so all these granular things needs to be listed. Kan, you kena bagi dekat information. You kena turun ke padang, you kena bagi taklimat dekat cikgu-cikgu ni. Bukan melalui Zoom sahaja ya. Bukan you kata, okay, bulan depan kita nak buka sekolah. Everybody get ready. Cikgu tu semua panik. Oh my goodness. Alamak, ada sekumpulan daripada cikgu dah anti-vax. Macam mana nak buat? So you have to address the issues. Cikgu yang tak ambil vaksin lagi, do you allow them to mix with kids who cannot be vaccinated? What is your stance? What is your policy on teachers who are unvaccinated, who can get vaccinated, but they refuse to get vaccinated? You nak bagi tak dia dengan kanak-kanak yang extremely vulnerable ni? Alright, kalau budak-budak tu terjangkit daripada cikgu yang tak nak vaksin ni, what is your backup plan? Do you have a compensation? Do you want to fire the cikgu because they have put these kids in danger? So all these things you need to iron out. You cannot wait for something to happen and then say, okay, you know what, kita tutup balik sekolah sebab membahayakan. Alamak, orang-orang marah. Tak apalah, kita buat survey lepas kita announce. Right? That's what happened, right? They announce, lepas tu dia buat survey. Sedangkan I think the previous Minister of Education already did a survey and told the minister, don't, I've already done a survey, none of the parents want to open. Dia buat juga, lepas tu dia buat survey lain. Lepas tu alamak, betul lah, parents tak nak, tak payahlah. But at the same time, how long should the minister or the ministry keep listening to the parents? Takkan parents dictate the minister on how to operate school, betul tak? Something's wrong there. Kalau macam tu, baik kita cakap, okay, selagi you tak letak aircon dekat semua
kelas dekat dalam Malaysia ni, tak ada satu ibu bapa pun yang akan hantar anak pergi sekolah. Is the minister going to listen to that? Right? So that is why, as a policy maker, you need to take the high road and you have to do your job. How do you do your job? Is making sure that the policy that you are about to implement is acceptable by all the parents. And how do you do this? And we've learned this so many times, kan? Bila you nak buat apa-apa decision, you must include stakeholders in your discussion. You must include lah ketua-ketua PIBG, ketua-ketua apa, tak kisahlah ketua apa yang ada kat situ, masuk discuss, ask them what are their concerns. Because then, from there, you can draft a policy that can be good. And you tak boleh ambil PIBG daripada sekolah, macam TKC lah, macam daripada VI lah, daripada elite schools. Because these people will not give you the true picture on what's happening, say, in a school in Kelantan, school dekat Terengganu, school dekat Kedah. You have to go to the worst hit areas where you have high unvaccinated teachers. Bring them, kan? Kan sekolah kan diorang, what do you want to do with these people? Do we allow them in? Do we put them on administration work, admin work? Transfer them. Apa you nak buat? You nak pecat ke? Kalau you nak pecat, what is your local standby? Ada tak undang-undang? Ada tak kuasa untuk membuat begitu? So all these things has to be discussed with them. And the sad thing is, knowing from the track record that has been seen, we know that this is not being discussed. So dekat situ, we asking your question, when can you open the school? We can open the school when there is a safe policy in place. And until we have a safe policy in place, none of the places that we want to open can actually even be called safe.
Okay, so meaning tak safe lah now, right? That's what can tak safe.
None of the places are safe. Even the shopping malls are not safe because you don't have a policy.
Okay.
Kan? Too short vaccination for people to come in, tapi pekerja tak vaksin. Ataupun pekerja ada 1 dos vaksin. I mean, it doesn't make sense when you do that, kan?
Yeah.
Security guard yang jaga, who is going to meet 1,000, 10,000 people a day, that person is not vaccinated, tapi dia boleh kerja. Ataupun dia ada single dose vaksin. Tapi orang yang kunjung ni semua yang ada 2 dos. Right? Tapi dia can be the super spreader. So it doesn't make sense when you create policy sebab you main-main cepetik pada langit. So that's the problem that we have right now.
All right. I think from me, that's all the questions. So now, I nak buka the floor pada our audience. Boleh, Dr. Farhan?
Boleh, please.
Okay, Daryl. Siapa nak tanya soalan dulu? Ke nak tengok kat chat? Medi bukan nak tanya ke?
Yes, I do have a question, but it's more towards childcare sebenarnya. Because childcare is a very important unit kind of for parents to be able to work later. So what are the indicators we need to be aware of before we can consider opening childcare centers and kindies? Thank you.
Well, childcare centers and kindies, number one, I think just the top of my head, this is basic protection, right? So if all the parents of the kids who are being sent to childcare are fully vaccinated, and the teachers who are taking care of childcare are vaccinated, then the childcare should be safe. The center should be safe. So that's why I say that you need to have a policy, whether you can actually check the parents who are sending the kids, are they fully vaccinated or not? Kalau tak, tunggu lepas 2 minggu second dose, baru you boleh hantar balik kepada childcare center kita. So these are steps that we can actually think of on how we can actually do it. And the reason why we do that is not that we want to be discriminatory, right? We're not saying that macam alamak parents yang tak nak vaksin, tak boleh hantar anak ke situ. No, because right now you're putting the life of other kids in danger. So you are not trying to protect just one kid, but you're trying to protect the entire center. And I think it's counterintuitive for us to move backwards and say that macam tak apalah kalau ada positif kita tutup. No, isn't it better for when we open we don't have to close anymore? That when the center operates you don't have to close the center anymore ever? So what is the safest way possible? That's the route that we must take. And for childcare centers, that's the way that we have to do it.
So ni ada question from Nas Ali. Who determines and vet the policy to be safe? I hope it will be the health experts. Is it the health expert now?
Well, I hope so too.
Okay. Clearly not.
But from a lot of the track record, health experts can advise, but ultimately policymakers dictate policy. Hence why politicians play an extremely important role especially now in a crisis. So that is why whenever we don't do well on the ground, you have to relook at the policy, because we have to follow orders because we are civil servants. Kita ikut arahan kan. Jadi arahan itu, kalau arahan itu tidak betul, siapakah yang patut dipersalahkan?
Okay. Ada soalan from Sharif, Dr. Fatima. Fatima, I don't understand your question. Can you just
Yeah.
Okay.
My question is, because you did say that if the parents are vaccinated, the teachers are vaccinated, that is considering we have one child that we're sending to one institution. But if we have a few children that are being sent to different places, then does that not increase the risk of them spreading the virus if one catches it, for example?
True. So definitely you will not be able to eliminate the risk, but we may reduce it as much as possible. So Fatima, let's say you have 3 kids. I know you don't have 3 kids. Let's say you have 3 kids. All right. One is in high school, one is in primary school, one is in kindergarten. All right. So the secondary school kid can get vaccinated. Primary school, kindergarten, not yet. But you and your husband are both vaccinated. Your first kid is also vaccinated. Now your second kid and your third kid goes to a place, primary school and a kindergarten, where all the children who go there are from families who are fully vaccinated, and all their teachers are vaccinated as well. Now the risk of them actually getting COVID is extremely, extremely low. So even though they mix with you, you know that they have mixed with kids who are actually from green families. So that's the idea, and that is actually the basic concept of herd immunity. Because in the end, not everyone can actually receive the vaccine. But if everyone who can receive it takes it, then not everyone needs to be able to get the vaccination. Maknanya people who are immunodeficient, yang ada cancer, yang tak boleh ambil vaksin, these people will automatically be protected. Because kita ni yang ada vaksin ni, we are like a wall around them that we protect the virus from actually getting to them. Kita lah tapis. So paling-paling pun dia boleh ada ketumbuhan dekat hidung. What was it? I can't remember the word. Membiak, ya. So dia membiak kat hidung kita, dia tak bagi kat orang lain, macam itulah.
Okay. Alright, baik. Kejap, sebelum I baca soalan ni, I baru teringat. Last question to you. What do you think of vaccine mandate? Kalau macam sekolah, let's say diorang nak buka sekolah, do you think we should have that, paksa orang vaccinated?
I think no matter what sort of policy or law that you want to take into place, there is actually a risk-benefit ratio that you must actually take into account. So you must look at it from both sides. If you put something as mandatory, that means you have to make sure that the law is there to punish for those who don't do it. So then you have to start thinking about on the context of law. What is an acceptable punishment for somebody who extremely refuses to take vaccine? Do we put them in jail? Do we fine them? Do we compound them? And once that is stated into law, then we have to start thinking, alamak, has the government been overreaching in enforcing something like that? If they can do this to something, what if they do it to something else? What if suddenly Malaysia says semua orang kena pakai tudung, kalau you tak pakai tudung, you akan kena saman 10,000 dan jail setahun. So it opens up a lot of doors if you look at it from that sense. But on the other side, if you don't make it mandatory and you have 10 million people yet to be vaccinated, how do you want to do it? So for me, it's extremely simple. If you ask me, how do you want to do it? If you have refused the vaccine and you get COVID, all right? So this is talking about once we have done all, right? So we have said that up until 31st December, everybody should get the vaccination. So we've completed the whole exercise. So 1st of January 2022, if you get COVID and you are not in the exempted group, right? That means you are considered as the person who refused the vaccine. Number one, if you get hospitalized, every single cent of your hospitalization, you must pay for it. The government will not pay a single subsidy for you, which means that if it costs 25,000 ringgit, you kena bayar 25,000, right? You have to pay because you are burdening the government because you refuse to take the vaccine. Let's say you don't end up in hospital or ICU. All right, let's say you're quarantined at home. So we have a fee for quarantine for anti-vaccine or people who refuse vaccination. For every day that you're placed in quarantine, you must pay 1,000 ringgit. So 10 days quarantine is 10,000 ringgit. Right? Because you have brought this to yourself.
Yes.
Because you have refused the vaccine. So why should we subsidize because you refuse?
Yes.
Rather, we charge you because you refuse to take it. So kalau you are still refusing to take vaccine, you bayar lah for you and your whole family. So kalau 5 orang in your family get COVID, 5 orang kena quarantine 5 hari, you bayar lah 50,000. Go ahead. Sebab kenapa I kena tanggung? Sebab I bagi solution so that you don't get it. But once you get it, I pula nak kena jaga you.
Yes.
So kalau I nak kena jaga you, you bayar lah. Right? So I think that's a middle ground that we can look for. Right? So if you end up in hospital because you don't take the vaccination and you use all our ICU beds and you memenatkan kita, all the doctors in the intensive care, you bayar lah 20,000 sehari. So I'm going to charge you 100,000 for it because I am no longer responsible for taking care of you because I have given you the opportunity to take the vaccine, but yet you refuse it.
Yeah. Please table that. Kalau masuk parlimen, you table that for anti-vax punya ni kan, because that is brilliant. All right, let me baca soalan ya. This one I don't understand. As they're speaking about scientific data, has there been any research on people dying from lockdowns? What do you mean this? If so,
I think she wants to talk about suicide. I think she wants to touch something on mental health.
Yeah, I think so. If so, is it important for the general public to be aware about it?
Of course, it's extremely important. For your information, since the lockdown started after MCO 2.0, the calls that has come into the call centers that have been recorded. So this is recorded calls, yeah. So unrecorded, of course, there's many more. So this is the tip of the iceberg. The numbers have increased by 8 times. All right.
Okay.
Now the suicide rates have also increased. All right. Selangor has recorded the highest number of suicide cases. All right. And the shift is the majority of the people or the big bulk of the people who are committing suicides are actually Malay Muslims. All right. So we are seeing that shift and we think that there is an absolute gap here because a lot of people are actually extremely stressed out.
True.
And you may not think it because you may be able to face the pandemic, right? You are perhaps for some, it's about thinking of what to cook. Today nak try menu apa, nak try masak apa. But for some, it's about thinking whether they're going to get kicked out of their house tomorrow because they have been overdue on your rent for the past 6 months. Or, alamak, kita nak masak beras ni, kita half portion lah because kalau kita masak ni habis, esok dah tak ada food. And even people who you think are doing well, even on Instagram, even this, you look at them and you think that they are suffering, but actually a lot of people are. So when I was in some of the vaccine centers, a lot of them were actually flight attendants. All right. So some of them were actually married to pilots and all these things. Now they have no job, right? But they have a high amount of liability. And you know what, for them, and they were telling me that it would be extremely okay for us, even if we get 2,000 ringgit this month, so that we can cover for our basic food and utilities, right? And these are people who've been making 20, 30,000 before, right? And the current statistics have shown that a majority of the people who were previously in the M40 group have now dropped to the B40 group, right? You cannot see it, right? Because diorang ada kereta besar tau. Tapi sebab moratorium, dia simpan kereta lagi. But they are actually suffering. So that's why you cannot judge it on that. And these things actually take a toll. And for some people, they actually calculate. Actually, it is better for me to leave this world rather than for me to be in it. Because I suffer if I'm alive, I'm actually better off when I'm dead. Because kalau I mati, my wife dapat insurance, ni dapat. So they take these steps that we cannot think of. And it's something that must be addressed. And yes, it's extremely, extremely painful if we talk about it.
Right, thank you, Dr. Farhan. Okay, baca lagi. You have to rope in the public health experts. Risk management must be top notch. Please, I hope you can help to ensure the policy will be watertight too. So that's comment for you. So schools are usually open from 7 to 1. Do you think schools should reduce their opening hours, or that doesn't matter?
It doesn't make a difference, right? Because you know the Delta variant, you know the SOPs, right? Some are saying it's seconds. They have come up with the research saying, oh no, it's now back to 15 minutes. Some are saying it's 5 minutes. Look, scientists, we are very fickle-minded, right? We always go on what is based there. But to make it safe, if you're spending 15 minutes with someone, you already exposed yourself to the virus if the person has it. So you spend 10 hours dengan orang tu pun tak adalah you reduce the risk. Kalau you reduce the school hours by 2 hours, you're not going to reduce anything. If it's there, it's there. All right. It's just that once you open, you should not limit lah. That is why daripada awal MCO 1.0, I have been a very strong advocate for McDonald's to be open 24 hours. I know it's fast food, but I don't see the reasoning why a fast food drive-through restaurant cannot operate at 24 hours, because it has little to no risk of contracting COVID, because you can use PayWave, orang tu jauh, you pass through, you order, you collect the order, they put it at the door and then they close the window, right? So you don't have that interaction. So things like that needs to be based on data and science. And the reason I advocate that, Ruby, is because every time I go back, makanan dah tak ada. So that's why I want it to be 24 hours.
All right. This one from Rosina Aziz. What do you think about Form 5 students who are going to sit for SPM in March 2022?
I think all kids aged 12 to 17 should get vaccinated now. We have to push for this. We have to make sure that these people get vaccinated. And once these kids get vaccinated, they should be shipped into the schools. They should make to learn. Because I think, because for me, because as a public health person, right, you have to know that I'm a bit different from surgeons and physicians. They look at case by case, and they think of how the patient is going to be tomorrow. When I look at this, I'm not even thinking of the school that's opening in 2021, 2022. I'm thinking of this entire cohort of generation. What is the impact to our society in 20 years? Will they be able to be an efficient workforce? What will be their grades when they actually enter university? What will be the quality of mental health status of these people when they actually go on later? Are these people resilient? So you may think that this is just a 1-2 year hiatus in our life, but actually the impacts will be felt for generations. So as much as we can reduce the impact and reduce the burden on all these children, especially school children, we must ensure that they actually get back to school as fast as possible. Kalau tidak, they will be social retards, right? Because they will not be able to interact. They will not be able to talk to people. They will not be able to know authority, to respect teachers, to respect elders, because these are things that you learn in school, right? And this is bonds and friendships that's being made. So it will have a severe impact on their lives later, whether we like it or not.
But hopefully by March 2022 tu dah vaccinated lah, 2 doses among all Form 5 students.
That's our wish, you and me both.
Yeah, all right. Okay, so Mageran is long overdue. I hope you will be in Mageran. So that's a comment for you. All right, apart from vaccination rate, what are the issues that need to be given attention in order to ensure safe opening of schools or childcare centers? So other than vaccination rate?
Then we touch on what we said earlier about the national testing strategy. So definitely you still need to keep testing. You still need to know who you want to test, how you want to test, when you want to test. So all these things must be ironed out. So if in case you have an outbreak, how do you want to do it? So this is simple tau, sebab macam you tengok kan, sanitization. Oh, we have to sanitize, close the place for 1 week. Oh. For me, it's completely ridiculous. It takes 45 minutes to sanitize the place and then you move on with your life. Kenapa you nak tutup sampai 3 hari, seminggu kan, sampai 2 minggu certain places? What's the point? It doesn't make sense because the data and science doesn't tell you that you should shut down for 2 weeks. So these are a lot of things that we have to discuss lah. So there's banyak benda kan, even ventilation and all these things for childcare centers. So many things that we have to iron up.
I nak tambah sikit, but ada someone tulis, but testing is very expensive. So how? Betul
Yeah,
ke?
and that's the reason why right now you have the saliva test kits, correct? And they
Mhm.
marketed it at 39.90,
Mhm.
right? Now I know for a fact that the kit cost to manufacture is only RM5. So the government should use whatever law and provisions are there to actually put a ceiling price to make sure that it's only what, 10 ringgit or even much cheaper. And instead of subsidizing oil and sugar, where
Mhm.
you want people to reduce obesity, perhaps the subsidy for sugar should be going into subsidizing test kits,
Testing.
right? Because you tak subsidize test kit, orang mati sebab kena COVID. Tapi you subsidize gula, orang kena obesity, mati sebab kena kencing manis. So the government should start thinking, right? Perhaps put in money to save people, not put in money to kill people. So yeah.
Alright. Okay, ada satu soalan tadi. What is your opinion about opening school to only Form 5 students in boarding schools? Is it less risky compared to sekolah
Of course, because you can actually keep them in a bubble. So kalau sekolah asrama tu, you put them in a place, you lock them in, so it becomes like a prison lah. So it becomes a small center where they are kept inside, so they can move freely, they can play sports and all these things. But as we see so many popular policies have come in, oh mak bapak boleh datang visit, mak bapak boleh ni. So the moment you do that, it doesn't make sense anymore. So if you want to start thinking of a policy macam MRSM, you say, okay, MRSM, all these kids are going to be shipped out, they're going to be staying in the MRSM for 6 months, lock them in the MRSM for 6 months. Even the teachers need to be locked in as well, right? So you keep in that bubble. Tapi bila you dah tutup and kunci diorang kat dalam tu, they're all vaccinated and they have been tested, you can let them do it freely. Diorang boleh makan sama-sama, diorang boleh main bola sama-sama, they can play sports, they can swim and all those things. You don't have to limit it because they're already in their own private bubble.
Okay. All right. This one, my take is that we must have an oral antiviral med like Tamiflu or for flu before we can expect things to return to even a new normal of mass. When do you think an oral antiviral will be available?
Well, I think that one you should ask the pharma companies. I'm sure they're definitely working on it. It's extremely wishful thinking, but I think the data and science shows that instead of treatment, it's always better for us to go for prevention. That's why vaccines are always the first choice, because it's much better for us to vaccinate, so that at one point it will become like MERS-CoV and SARS. It will die off by itself. So kalau you just treat, you never stop, you don't actually get rid of the virus.
All right, so I think that's all the chat. Anyone else want to ask questions to Dr. Farhan? Or everything's clear? Macam, are you sure? Susah ni nak book ni. Dah bila lagi dapat? Vaccines, okay, kejap. I baru tengok. Vaccines with breakthrough, okay. Itu just a statement. Can you comment? Vaccines with breakthrough.
Vaccines, oh, okay. So this is people who are vaccinated, but they can actually get COVID. So yes, because you know that none of the vaccines are 100% efficacy. So you do understand that they can actually get infected as well. But what's important to remember is that the risk is extremely low. The probability is extremely low. And what's another thing to note is that people who get vaccinated, they have a very, very, very low risk of actually getting severe COVID. So breakthrough infections will definitely occur because the vaccines are not 100% foolproof. We know this. But it will extremely save as many lives as possible. And that's what's important.
All right. The numbers of death from fully, okay, kejap, I tak nampak. All right, the numbers of death from, okay. What about those people claim that they are autoimmune? They can't be vaccinated? Ada orang claim ke?
Yeah, I mean, they can't be vaccinated. Are you saying that they have natural immunity or they have an autoimmune disease? So there's two different things. So one is they have a disease, so they cannot get vaccines. So they are from the exempted group and all these things. Some people are actually claiming that they have natural immunity. So this is actually quite true. If you actually had COVID, you will have some sort of protection. But the studies have shown that it actually doesn't last that long, perhaps 2 to 3 months at most. That's why you still need to get yourself vaccinated. But yeah.
Okay.
Those are the two groups.
Okay. Okay, this one, the numbers of deaths from fully vaxxed is not given. Definition of COVID death.
COVID death. Technically, we are also asking the same question because some people who have gotten COVID, they have technically what we say recovered after the 10 days, but 3 weeks later they pass away. Some of them are not categorized as COVID death. So we're actually pushing for this because we want to make sure that this is not that COVID related death, which means that it could be due to long-term complications, perhaps 3-4 weeks later. And to be honest with you, there is no definition right now. And I think studies are still going on because they still have to make sure that people are not dying due to long COVID.
Okay. All right. So this one, what is your take on third vaccination? Like after the second dose, you might need the third one. So
It's absolutely necessary because none of the vaccines are going to last us that long. So the data has shown that with a third booster dose, that we actually increase our neutralizing antibodies and it actually gives us better protection. So I'm all the way for booster doses, and it's the same, right? Because if you take influenza, I take my influenza vaccine every year because it updates itself with all the new variants. So I believe that we are heading towards that line for COVID as long as it's actually within us.
So how soon can Malaysians get the third dose?
Well, I think before we talk about that dose, we have to make sure that most of the Malaysians get their first dose. So kesian dekat Malaysians yang lain, they still don't have the first and second dose. So we are going to make sure that these people get the first dose and second dose as well. Then we can talk about that dose. But I think strategically thinking, the earliest third dose that we can actually start rolling out will probably be towards December or very early January.
December this year?
Yeah.
Okay. DG informed recently that there were only 4 deaths of fully vaxxed people. All right, only 4. Okay.
Yeah.
Oh, yeah.
Only 4. Yeah, I can't comment on it because that's what's being reported. So I'm able to verify if it's 400 or if it's 4,000. If he says it's 4, then you have to assume that it's 4 because that's the data that's being presented.
Okay, this one, higher learning institutions have yet to come up with a reopening strategy either. How will opening higher learning institution be different or similar to reopening of schools? So, belum ada lagi?
Yeah, well, higher learning institutions should open first because all the people in higher learning institutions should be able to get the vaccine because they've passed the age of 18. So that should be what we have to push through. And then we have to make sure that all the academicians and all the tutors also are actually vaccinated as well, so that we can actually have a safe environment. So higher learning institutions should be the first to open. Okay. Then we can talk about schools.
Okay, all right. So I think that's all. Anyone else? If you maybe ask questions directly, what's the main challenges working with the state that records highest cases in Malaysia? So this is your experience. Apa challenges?
Main challenges. I'm actually very happy that my state has the highest number.
Morbid.
You have to understand, right? I'm extremely very happy that that Selangor has the recorded number higher of cases for the past 2 to 3 months, or 4 or 5 months for that matter. It's because I know that in Selangor we are aggressively testing. So whoever has COVID, we're actually finding them and we are quarantining them and they know that they get COVID. So we're making the place actually safer. And if you can look over the data over the past 1 week, you will see that we are now going on a lower trend of positive cases. Slowly, but it's actually going down for Selangor. And I'm actually happy because before you can actually reduce the numbers, you have to actually find how big is the problem. After you know how extensive the problem is, then you can start working on actually tackling the problem and reducing it. Only then can we actually exit the pandemic. And I'm very proud. It means that I have done my job well. You pergi tanya negeri-negeri kat mana you duduk tu, kenapa you punya nombor sangat kecil sedangkan it's all over the place? Are they doing their jobs in actually finding the cases? That should be the question.
The testing under Selangor tu memang Selangor yang fund kan? Bukan, it's not even under federal.
It's mixed. It's run mostly by federal. So state always plays a complementary role.
Okay, all right. So this one, it's recommended to get booster 6 months after the second dose. The frontliners are due for the third dose already, but I'm not hearing the booster dose yet.
Yeah, because data is still coming in. So before we actually go for third doses, as much as I'm an advocate for it, we got to make sure that it's actually safe. And we got to make sure that the combination of vaccines are given in the proper order because there are mixed booster dose, there are same type booster dose. So there's a lot of things that still needs to be sure before you can just start jabbing everybody. But like I said, even before third doses can be given, we should actually give everybody a chance to get their first and second doses first.
Okay. All right. Any more questions from the audience? Maybe one last. Ke tak ada dah? Ke very clear.
Alhamdulillah.
Okay, tapi just a reminder to the audience, my student dah letak feedback form, so just letak if you think the event is bad ke good ke, just yeah, inform us, we can improve in future. Okay, Dr. Farhan, thank you so much for joining us today. Susah nak dapat tak tahu lah bila. I hope in future we can invite you for a similar
No worries.
session.
Shall we take a group picture before we go?
Yes, of course. Kejap. Of course. All right, so semua orang bukalah your camera, so I will ambil gambar.
Siti Sarah is already posing, so yeah, we have to do it.
My
fast.
RA.
Yeah.
Okay, so boleh just senyum. Kejap. Alright, dah ready ke? 1, 2. Okay, macam belum ready. Jap. 1, 2, 3. Okay, kita ada 2 galeri. Kejap. Lagi 1.
Okay, all right.
Okay, satu lagi. 1. Okay, buka kamera dan senyum je. Alright. Okay.
Awesome.
Alright. Thank you so much, Dr. Farhan, and all the best to you. So
Same to you. Take care very much.
Yeah. Assalamualaikum.
Waalaikumsalam warahmatullah. Take care, everybody. Stay safe. Bye-bye.
Okay. Oh, I can stop recording.